YouTube. And if you hear anything in the background, that's Dr. Elissa's son.
Yep, that's the baby.
That's the baby.
So.
This is Dr. Elissa with...
Hi, Dr. Elissa, going with Pelvic Floor for Moms. We're talking about C-sections today because we've been doing a fun little experiment in the clinic. We have two people. Dr. Jesse has had two C-sections and many other surgical things.
I've had 4 abdominal surgeries.
Yeah, so lots of scar tissue. She's also learned that via imaging, MRI, which the doctor commented.
CT scan actually is what it was. Which if you've ever had a CT scan, it makes you feel like you're peeing your pants, which I didn't realize. But yeah, the surgeon called me after. This was 5 years ago because I thought I had a hernia from all the work in here with adjusting, and it was really just some bulge of scar tissue that they saw in the CT scan. And she was saying that she's never seen that much scar tissue in an abdomen. So I should probably preface, I had a hernia when I was like 7 years old. So I have a scar on like in my lower groin area. I had an appendectomy, so I lost my appendix when I was 17. And then of course went out running probably as soon as I possibly could, which was not smart, but who tells kids to do anything properly that way or like back then. And then I had 2 C-sections as well. So yeah, 4 abdominal.
Fascial release with like my hands and movement, cupping, any sort of stuff to get that scar tissue moving. And Addie has had some more puckering that like comes and goes because she is more fresh postpartum. And so we've been like experimenting with like, well, what happens when we dry needle that? Does it go away? And how do we address this? So one also in my head, we looked up scar tissue continues to remodel for 2 years after the injury, postpartum in this scenario. So like Addie is in that 2-year time frame. Oh, the baby wants out.
And I'll just keep going. So with Addie and the remodeling, because it takes 2 years to remodel, we are working to see if dry needling impacts the puckering as she is progressively remodeling. And she initially did a ton of acupuncture, and so now we're trialing the dry needling. And so I don't know if you guys know, but the acupuncture is not as deep. So the dry needling needles go much, much deeper into the tissue. And so she had her first session with dry needling last week because she noticed some puckering, and we weren't sure if it was due to the tension through her abdomen, like her abdominal muscles, or if it had to do with the actual scar tissue. But Dr. Elissa dry needled it, and literally the next day, it was insane. Yeah. The puckering was gone. Gone. And again, hers is super fresh. Mine is not. Mine is over a decade old. And so the work we're doing is a little different, but to have that kind of success in a day was absolutely insane. And it was tender for her. Yeah. Not as tender as it is for me when I get dry needled. I think just because I have so much scar tissue. But not painful either. Just
So I think Addie's is gonna continue to like ebb and flow a little bit because she's still in that like acute healing phase. And I think the work we're doing with Dr. Jesse will be interesting because she's 10 years past, and so I don't think your scar tissue is changing as much or at all. So I would imagine like the work and the release that we do might just like stay. Yeah. And not change. We don't really know.
When she says not changing, she means like I'm not remodeling anymore, right? So like it's not restructuring at all. It changes. What we're finding is it changes when she dry needles me, which is super interesting because once you break up scar tissue, essentially it stays broken up.
So yeah, for you, I think it's just going to get better and better and better and not have like a back step because something gets tight or remodels in a different way, basically.
1000%.
Yeah.
The really cool thing we noticed, so the first week it was, and again, we're sharing this on YouTube, like we're actually filming these sessions, so you can look at those if you want to see what we're actually doing and what the dry needling and the cupping looks like, and even just the body work, because she's doing a ton of mobilization and like really digging in there, and then also working with my hip mobility while she's working. But where was I going with that?
We posted it on YouTube.
Yeah.
So you can see the journey maybe?
Oh yeah, so we did not do the cupping the first session. We did it the second Did we do the second?
I don't remember. We've done hands-on manual stuff all the time. So
Yes,
I think the first 2 we just did like fascial release. But also, you had such a strong emotional response.
Oh, yeah.
Especially like the first 2. You can only handle 2 needles because
you
grab my arm and you're like, I don't know if I can keep going. And so like I asked for permission and like we advanced the needle, but like you just had a lot of stuff come up.
Well, and I was teary, then Elissa got teary, and then Addie was teary, and we just had a moment, which I don't think is abnormal for scar tissue when you're working through it, because your body does keep the score. No, I'm gonna throw that out there, because when we were in there, and after I got emotional, Addie was like, have you read The Body Keeps the Score? Which I will warn you, because I have since downloaded it on Audible. It is a very hard thing to listen to because it's all trauma. Like, it's just trauma story after trauma story. But man, is it informative, and just, it's a nice reminder. I'm not quite done with it, but it's a really great reminder for how much your body holds trauma. And trauma can be a myriad of things, right? So it doesn't have to be something that you necessarily think of as traumatic. It could even just be part of your birth story, which for me, obviously it was. And I had to grieve some of that too when I had my first C-section. That was actually really hard for me, especially being in what is considered a more natural field. I think there was this expectation that I was just gonna have this perfect natural delivery, and I didn't. And so then reframing how I looked at it, and just like, I don't know, it was a lot. I had to kind of grieve my way through it. Now I love my story. I absolutely love my story, but it does mean I have those C-section scars, and I'm sure I hold a lot emotionally there. Okay, the coolest thing that was, though, we were just talking the other day, I came in, my husband, without being prompted, said something about that shelf. So when you have a C-section scar, I feel like everybody, I mean, if you're watching this and continuing to watch it, it's low. It's like right above that pubic bone, and so you end up with a shelf. I've had a shelf for a decade, and it hasn't mattered how big or small I am, how much, extra weight I have on my body or not. I've had a shelf because it like puckers, it like holds it tight, so then any additional tissue sits on top of that, and it looks like you have a shelf. And the other day, cannot make this up, my husband said, the shelf is gone. Like because how
I don't know how deep about he was touching.
No, we were literally cuddling in bed. It wasn't anything. We weren't having relations, but he noticed, and I just thought that was the neatest thing. I mean, it like put me into tears, because it's been something that has been so hard for me with the scar tissue. I have not been able to get rid of that shelf. And so I am seriously attributing it to what Dr. Elissa is doing right now with me 10 years later. We are 5 sessions in, which is pretty cool. Oh, that's what I was gonna say too, the cupping. So the third visit, Dr. Elissa did cupping where she moved the cup along the scar, and then the next visit she did it where she just pulled up, and it was actually when she pulled up that I felt the most. I actually feel it into my low back, like very locally.
Yeah, you said you can like pinpoint where you feel it.
It's crazy.
And I was talking about, like, I've seen some posts about C-section scar tissue and how it can contribute to low back pain, because like I explain scar tissue to people as like if you imagine this is I was gonna do Running, but it's too movie. If I pull a spot on my shirt and I twist it up, right? So here's my scar, but now I'm getting wrinkles.
Switch this way so that the people on Instagram
I was looking at the camera. If I'm pulling here, but I'm getting wrinkles all the way along my shirt. The baby's falling on the ground.
Baby.
And so it's going to pull from all these different directions. So if I have a scar here, that fascial tension is going to pull all the way around my body. And so that scar tissue of any type, C-section or not, is going to impact so many other parts of your body. I've treated C-section scar for pain with orgasm, back pain, and side joint pain. And so it's interesting that you could feel it so pointedly.
You should talk about what I felt in my derriere, in my bum.
Yeah, which I honestly couldn't explain either, but
It was
there's
super
no
interesting.
explanation needed, really. But it's like, the third time I was just needling the same spots that we've done, and we stuck a needle in, and Jessie was like having it was like really painful. You could tell, and you told me that you could feel like pressure in your rectum and just a bunch of rectal pain.
Yeah, it was very pointed rectal pain, and to the point where it like took my breath away. Hi. And then what was interesting was the next time we did it, I did not get that same pain.
Right. We also did that on that time, some manual rectal fascial release, so like some visceral mobilization, like through the abdomen manually. He's take him back because your glasses are very entertaining.
I know, but he's very happy.
Okay, great.
He's smiling. He's smiling,
Yeah,
snuggling. Yeah, anyway, it's been the coolest thing, the neatest experience, like both emotionally and physically. And then I think it's contributing to my pelvic floor. What's been interesting, well, obviously it's contributing to my pelvic floor, but what's been interesting is like every step of the way, I've never had severe leakage, but I've had intermittent bouts of leakage, which is not uncommon for C-section mamas or women in general. I say common, right? It's not normal, but but we've done internal exams and internal work. I almost think this is more effective than, maybe not more, but it's at least as effective in working on my leakage and like the incontinence component as when we do internal pelvic floor work. And I'm always working on the tension in my pelvic floor. Actually, it's my left side, which is super interesting too, because Dr. Elissa feels it both internally, and then she can feel it also on the scar, like the left scar or the left side.
And that's where you feel it pull when we distract the cuff and then just pull it. You feel it all in that like left lower quadrant, which is also where your rectum goes too, I guess, which is interesting as well.
Yeah. So, I mean, you know, it's a work in progress, but we're getting there. We are.
Well, so the fun experiment is like, I've never really, I mean, I've needled people's scars. I never really know what to expect, what's our expected outcome. So to be able to like treat it from A to Z and just like see the progress and also compare like a new scar to an older scar and just what happens, and it's been cool to see. So also we can create a little more like context and like kind of protocol around it of like, well, here's what we found is like what's effective.
Yeah, it's basically our own case study
here
in the office. So yeah, if you guys have questions or thoughts around this, or if you've done this before, we don't know anybody who has. So if you have, tell us your your results.
Pearls.
Yeah,
clinical pearls, I guess, as a clinician, but yeah, your results as a patient.
Tell us if it worked or didn't work, and what you found, and ask the questions, truly, and we'll keep documenting. Like I said, we're gonna kind of keep sharing. We have before and after photos too, so it'll be really interesting to see if you're able to see that shelf disappearing physically in the photos as well. So I'm excited. Okay, you guys have a wonderful Friday and a wonderful start to the weekend. Dun, da, da, da. We'll see you later.